Hi, Amber. Thank you for doing this with me.
Yeah, hi.
Hi, I'm Jennifer. I'm your pediatric nurse and lactation education counselor, as you know. So we talked a little bit before this, and you told me that you want to breastfeed Connor again because of you had said due to the pandemic, you're now working remotely, and initially you stopped breastfeeding, but you're having some problems,
Yeah,
right?
yeah.
So can you tell me a little bit more about
So I have been exclusively pumping for a while just because I've been having a lot of pain with nursing and it's just been frustrating for him and me. And I'm like, now that I'm working remote, it's really hard to balance pumping and taking care of him and giving him a bottle and all of that. So I'm like kind of thinking that I feel like I'm not going to be successful doing this much longer. And my family's kind of like, I talked to my mom about it. And she said, well, you had formula and you were fine. And so I know he'll be okay for her to have, but like, I also it's important for me to try to do this because I want to and I'm passionate about it, but I also don't think it's sustainable for me to do like exclusively pumping, but it's too painful when I'm nursing.
it?
So I just don't really know where to go from here.
Okay, so let's talk about this. There are times when formula is appropriate,
Yeah.
right? Um, Depending on, the health status of mom, or if mom's not available, if donor milk's not available, and if there's other issues with the baby where baby's not gaining weight. So obviously, we've met Connor.
Yeah.
He's gaining weight fine. He's getting nourishment. You know that you have milk and you've not stopped pumping and then started again. So you have a good supply. Those are all good things. So, there are risks to feeding your baby artificial milk, right? Artificial milk can increase the risk for infections, and it can be constipating, and there's a whole other list. I'll give you that paperwork. So maybe when you're talking to others, that I'm sure they just want to be supportive. They love you. They don't like seeing you in pain. Um, they want you to have the best success, and they want you to know that it's okay, that it's not like a failure. You're doing a good job. I understand that, kind of what I'm hearing is you've hit a wall because you want to nurse. Pumping's too exhausting because you're kind of double doing it. Plus you're working.
It's like twice the amount of time.
Right. So what we need to address is maybe the root cause of why are you having pain?
Okay.
So let's talk about this, and then maybe I can do an assessment. I know due to modesty reasons, we talked about kind of doing the breast assessment off of camera, and I've already assessed Connor's mouth, and it seems like anatomically his mouth is great. Now he may be adjusted to the bottle a little bit. And so with the nipple on the bottle, there's no latch that needs to be efficient, right? It's just they can latch on, they can get the milk, they can turn their head, and the bottle can go with them. So it's going to be a little bit different. You're going to kind of have to work together and learn together again as a single unit. But when you breastfeed and you feel that pain and you take him off and you look at your breast, what do you notice about your nipple compared to the other breasts?
Well, it's definitely like red and kind of inflamed, and it's definitely like tender to the touch,
Okay.
like very like raw almost.
Okay. Okay. And see, that's not a normal thing, but it's common. And there's a few reasons why this can happen. Have you noticed that the shape is a little bit more flat, or does it almost look like the tip of a lipstick?
Yeah, kind of.
Okay.
Yeah.
Because that's what I noticed earlier when we did our session off camera, that it looked a little misshapen. Now, to me, that signals that perhaps his latch wasn't deep enough. Now, could he get milk? Yes. Could he still be nourished? Yes. But this could be part of what's causing pain. So what happens is if he latches on, he's really hungry, and he grabs your nipple, and the nipple is not far enough in his mouth, and you still see areola around. He is, when he uses his tongue, he may be pushing your nipple up on the hard palate. And that can cause a lot of pain and it's not really sustainable, you know, and it puts you at a risk for infection. And then if you have an infection, that's going to be even more painful and might require antibiotics. And, you know, it's a vicious cycle. So I examined you. I do recommend if it worsens or if you get a fever, or if you have any open wounds ever, that you do call your primary care doctor for an assessment. And then, you know, as a backup, since I work at your pediatrician's office, if you ever have questions about medications, you can always also call us and we can refer to the pediatrician to make sure that whatever is being prescribed is safe for the baby. And a lot of medicines are. What I'd like you to try is with Connor is a different latch technique. I'm going to tell you about that in just a second. Have your water bottle here.
I do.
That's a really nice one. Wow.
I got it when I delivered my son.
You did. Oh, that's great because that leads me to a really good point. Before you sit down for nursing sessions, we're really pumping too. As you probably know, you get really parched. It's really great to have a snack available at your side, to have your water filled, a comfortable chair, a comfortable.
Okay.
And we're gonna massage those milk pots, and you'll feel because you've been pumping for so long that letdown. And you don't have to do this a lot, but it's just really gets that smell all over your breast and will encourage Connor to go wow because he's used to a bottle to say, ooh, this is I want to get all this milk. And then before you put him on after you hand express, you want to line his nose up with your nipple and make sure he, you know, you can wait for him to do a really big open wide and squish your breast in there and making sure that most of your areola is inside his mouth so he gets a big grip. So why don't we give it a try? Hand expressing. Okay, sounds good. Other hand, and you want to massage down.
Okay.
And if you put your hands, if this is a clock,
Mm-hmm.
here's 12, here's 3, here's 6, here's 9. We can put a thumb on 9 and a thumb on.
Okay.
There we go. All right. Let's see if my camera can get that. And how does that feel?
It's fine.
Okay, good. Let's get your towel back.
Thanks.
Sorry.
Sorry.
And so what you want to do with that milk is kind of rub it on your nipple or on your areola. And that's something that you can do after a feed too. I don't know if you do that ever when you're pupping. And then, can you hold here on the sides?
Mm-hmm.
We'll just
Put that away.
I just want to see that milk coming out of the bottle. Oh, and did you see the squirt? Great. That's exciting. So that's what we want to see.
Okay.
Wonderful. So before every nursing session ends, fine, good.
Is that better?
Yeah, much more comfortable. See how his lower lip is wide? Slowly. See what he's doing with his hands here? You can help him too.
Okay.
But it looks like he really is not. How does that feel?
It feels a lot better.
Okay. Are you having any pain?
No.
Hello there. Hello there. Okay. Nice and wide. Okay. Yeah, just like that. Okay. Just like that. And if you start feeling that pain again, I want you to gently put your finger inside his cheek. Okay. Release the suction. Okay. There you go. And line his nose up again and try it again. Okay. There. And you can check your nipple like we did before. And if you notice that it's misshapen or it's flattened, then that means that his tongue may be pressing your nipple onto his palate on the top of his mouth. But what we want is we don't want to see how we can't see your areola. We want to make sure that all of that in his mouth is in his mouth. Okay. And it won't choke him. Okay. Okay. And good. You have lots of milk. Okay. It is okay. And I think that if you
Yeah.
Yeah.
Yeah. A lot of times I'll just move it with him.
Right. And so when he's on the breast, hi, cutie. If he's on the breast, it's going to be a little bigger because obviously your breast doesn't move that way. But what we can do is we can create a calming environment.
Okay.
And I'm going to just close the door. I'm going to let you try to nurse. Hi, buddy. And you just holler if you need me, okay?
Okay. Thank you.
You're welcome. Okay. Come over here.
Okay, Amber. So, how are you feeling after that nursing session with Connor?
Good. I feel like it went better than it has been. So I'm hopeful that it'll keep getting better.
Good. And then I noticed, just to respect you, we decided not to have the full assessment. I noticed your nipple was more rounded.
Still a little bit pink. Did you have some tenderness?
Yeah.
Yeah, tender, but like not like the sharp pain that I was getting
Okay.
before.
Good. Good. Do you notice a difference when he was nursing? You didn't hear that clicking sound? That is another indicator that, perhaps the latch could be a little bit better. So, like we practice, just if that happens, or even if you're questioning it, it's just better to just pump him off, line up his nose, get a bunch of breaths into his mouth, and then listen. And what you should hear is, you should see his lower lip out, his chin moving, and you may hear swallowing, but you're not going to hear clicking from his mouth.
You don't want to hear your nipple hitting his hard palate.
So that sounds good. So, and then perhaps, you could share this experience with your family. It sounds like your spouse was really supportive of having me here, which is great. And that way it will lessen stress.
Stress on you. If you're not having pain, but you still can do what you want to do, which is breastfeed, and then you won't have to. Obviously, you have a lot stored as well.
Yeah. So you didn't end up returning to work. So hopefully this will fit your lifestyle. And if it doesn't, we
revisit that
Okay.
and see if we need to modify something. And it really does, I think, help that your partner is so supportive. And with your mom, again, I think that once she sees that you're happy and you're not in pain, maybe she will be more accepting, and then you can also teach her. Whereas she just wants you to know that she wants the best for you, and she wants you to know that if you had to go to formula, it would be okay.
Yeah.
But I don't think we're at that point right now because you guys did great.
Yeah. And you think he's like big enough and getting enough? Because I always worry that, even with the pumping, that he might not be gaining enough. And
So-
I don't want that to be, an issue.
And you know what? That's a great concern. I noticed because even at the pediatrician's office at his 7-month visit, he weighed 21 pounds.
Mm-hmm.
So he's actually in a really good weight.
Mm-hmm.
He's even heavier than, I think he's at the 76th percentile in his weight. And so he is doing great. And another indicator of, is he getting enough? Because I know when you're pumping, you can see. I
Yeah.
pumped out however many ounces. What did you say you were getting out of each breast?
One is more than the other. So you should get like 5 out of the left and then 2 to 3 out of the right.
Right. So he's gonna, you can see that. You see
Yeah.
what you start with. Well, we check is he gaining weight? So we know what his baseline is. We know he's definitely healthy. Also, is he making wet diapers?
Mm-hmm.
Is he making poopy diapers?
Mm-hmm.
What do they look like? Is he happy? Is he rested? Does he seem like he's satisfied after a nursing session? And I think that as far as what I've seen today, all of those answers are yes. But he's definitely over a healthy weight for his age, so that's good. And so when you nurse him, you could even if you want to check every few days, you can weigh him, or if you're concerned, you can always give us a call at the pediatrician's office, and we can set up a weight check with the pediatrician. It's a quick in and out, and just to kind of provide reassurance. So I'm happy to set that up and have a referral over as well.
Okay, maybe we can do like a follow-up in like a week or so. Just that would give me some time to practice and then maybe check
Absolutely.
back in because I'm sure I'll have more questions once we get going.
I would love to do that. Let's set up a follow-up in 1 week. And what I can do, if you'd like, is since I weighed him today, he was weighed yesterday at a 7-month appointment. I can bring my scale and come to you, and then I can weigh him as well. That way we can see that he's growing and that he's gaining, and then hopefully that'll be really helpful. Okay. Thank you so much, and thank you for being a part of my video while we do this session too. Thank you. All right, you take care.
Okay, thanks.